So with this mare, we have she's also in rehab. You'll see that the right front leg is shaved up. And you'll notice that if you look closely at the heels, and we'll show you as we come down, look at this more closely, that the heel on the left side is closer to the ground, and what we're talking about here is the bulbs of the heel versus where the bulbs of the heel are on the other side. So we have an asymmetrical heel height, and this changes the angle of every joint coming all the way up through the shoulder, and it causes the shoulder to rotate here, open up this angle, and that causes this to have the appearance of this shoulder being more bulged out. We'll take and show you from the back side, and you can compare this side with the other side quite nicely that way. So it really distorts the entire tracking of the horse. This is also, in this particular horse's case, this is associated with the fact that this is a right forelimb dominant horse as part of the laterality or natural crookedness syndrome that we see essentially in all horses. It's more pronounced in some than the other. But since this is a free leg, and she will spend more time with her leg out and putting it on the heel, whereas this right front leg is more of a support leg, and so the heel does not get the crushing effect and the ballooning out of it, so this heel stays higher. Now, the interesting part of this is that when I look at these horses and I determine this laterality aspect of it, about 75% of the injuries that we get to check ligaments, suspensory ligaments, will occur on the dominant limb, the one that is being used for support, the one that lands with more concussion with each stride. And it's interesting because this mare follows that pattern exactly. She had an injury to a check ligament, got that fairly well cleared up, and then she had an injury to the suspensory. So that all fits together here. So if we can get a horse like this, again, where we relieve the muscle tissues and so forth, then we can do a lot towards speeding up the healing. It's still going to take the rehab period, the tissue has got to heal, but if we take the tension off of the muscles, then the ligaments, check ligament, suspensory ligament, have a better chance of healing here. So now when we've determined that, what we want to do is have a look over the top of the horse here and see the asymmetry you have from the shoulder from one side to the other. This asymmetry is a major concern because not only does it affect the horse itself, but it affects the way the saddle is going to sit on the horse. It therefore affects the way that the rider is going to sit on the horse and cause twisting and torquing of the body. So we end up with a whole chain reaction, all starting from the difference in the heel heights of these 2 feet. So because this shoulder blade has rotated up, now this appears to be bigger on this side. With time, the muscles themselves will also enlarge here. So on this side, you'll be able to see that there's a little bit of dipping down here and a little bit of enlargement here. Let's see if we can just ask her to lower her head a little bit, and that will emphasize that just a little bit as well here. Alrighty, that should be quite good. Okay, beautiful, beautiful, there we go. So we won't be able to hold her in that position, but that's the key to what's going on here. And so we have a different degree of rotation in the scapula from one side versus the other. We also have tension on the higher side here with the foot with the higher heel. There'll be tension all down in and behind the shoulder, and that's what we'll show you next.